Welcome to the channel. Tuberculosis, or TB, is one of the oldest infectious diseases known to humanity, and despite the advancements of modern medicine, it continues to be a major public health challenge across the world. Preventing TB transmission requires a combination of awareness, practical measures, medical intervention, and global cooperation. Understanding how TB spreads and how we can stop it is not just a matter of science, but also a matter of saving millions of lives every year. TB is caused by a bacterium called Mycobacterium tuberculosis, which primarily affects the lungs but can also spread to other organs. The infection is airborne, transmitted when someone with active TB coughs, sneezes, or even talks, releasing microscopic droplets containing bacteria into the air. Anyone who inhales these droplets is at risk of infection, which is why prevention strategies must focus on both community and individual levels. One of the most effective strategies to prevent TB transmission is early diagnosis and treatment. Many people with TB remain undiagnosed for months, unknowingly spreading the bacteria to others. Public health systems need to prioritize rapid diagnostic testing, especially in high-risk areas, to identify infected individuals quickly. The use of advanced tools such as GeneXpert and sputum microscopy allows for faster detection and drug resistance testing. By identifying and treating active TB cases early, communities can significantly reduce transmission rates. Another critical strategy is ensuring that people who start TB treatment complete the full course of medication. TB treatment can take 6 months or longer, and many patients stop midway once they start feeling better. This not only leads to relapse but also increases the risk of drug-resistant TB, a much harder form to treat. Healthcare systems must provide patient education, support systems, and direct observation therapy to ensure adherence. Community health workers can play a key role by following up with patients, offering counseling, and encouraging consistent medication use. Infection control in healthcare settings is another pillar of TB prevention. Hospitals, clinics, and community health centers often become hotspots for TB transmission due to overcrowding and poor ventilation. Implementing infection control practices like proper air circulation, ultraviolet germicidal irradiation, and use of N95 masks by healthcare workers can drastically reduce the spread. Designating separate waiting areas for TB patients and ensuring regular screening of healthcare staff are also vital measures to protect both workers and other patients. Improving ventilation in homes, schools, and workplaces can also help prevent TB. Since the bacteria spread through the air, ensuring that rooms have open windows and proper airflow can dilute and remove infectious droplets. In densely populated areas, building designs should prioritize cross-ventilation and natural lighting to limit bacterial survival. People living in close contact with TB patients must be especially careful, maintaining physical distance and using masks until the patient is non-infectious. Vaccination is another important preventive measure. The Bacille-Calmette-Guerin (BCG) vaccine, used for over a century, offers some protection, especially against severe forms of TB in children. Although its effectiveness in adults varies, ongoing research aims to develop new, more powerful TB vaccines. Universal vaccination programs for infants remain an essential part of TB prevention, particularly in countries with high infection rates. Preventing TB transmission also depends on strengthening public awareness. Many people do not understand how TB spreads, leading to stigma and delays in seeking medical help. Public health campaigns, educational programs, and media initiatives can help dispel myths and encourage people to get tested early if they experience persistent coughs, fever, or weight loss. Reducing stigma also encourages those infected to adhere to treatment and disclose their condition to contacts for screening. Contact tracing is another vital strategy. Once a person is diagnosed with active TB, their family members, friends, and coworkers who have been in close contact must be tested. Identifying latent TB infection, where the bacteria are present but inactive, allows healthcare providers to treat it before it becomes contagious. Treating latent TB with preventive therapy can stop transmission chains before they begin. Nutrition plays a subtle but powerful role in TB prevention. Malnutrition weakens the immune system, making it easier for latent TB to become active. Ensuring people have access to balanced diets rich in protein, vitamins, and minerals can help communities resist infection. Public programs that address poverty and food insecurity indirectly contribute to TB prevention by improving immune resilience. Lifestyle factors also influence TB risk. Smoking, alcohol use, and exposure to indoor air pollution from biomass fuels can all increase susceptibility to infection and disease progression. Encouraging healthier habits and reducing exposure to harmful substances can strengthen lung health and overall immunity. Public health initiatives should therefore integrate TB prevention with broader wellness campaigns. Workplace health policies can make a difference, especially in industries like mining or construction where workers are exposed to dust and poor ventilation. Employers can protect their workforce by conducting regular health screenings, providing protective masks, and improving air quality in enclosed environments. Workers should also be educated about TB symptoms and encouraged to report persistent coughs without fear of losing their jobs. Another key element is tackling HIV, which significantly increases the risk of developing TB. People living with HIV are more vulnerable because their immune systems are weakened. Integrating TB and HIV services so that every HIV patient is screened for TB and vice versa can save countless lives. Providing antiretroviral therapy alongside TB treatment strengthens immunity and reduces disease transmission. On a community level, addressing social determinants of health such as overcrowding, poor housing, and limited access to healthcare can have a huge impact on TB control. Governments must invest in better living conditions, sanitation, and healthcare access for low-income populations who are disproportionately affected. Combating poverty and improving education indirectly contribute to TB prevention by reducing vulnerability to infection. Modern technology also offers new ways to fight TB transmission. Mobile health apps and digital adherence tools can remind patients to take medication, track their progress, and alert healthcare workers in case of missed doses. Telemedicine platforms can connect patients in remote areas with doctors and nurses for regular monitoring. Digital contact tracing systems can identify potential outbreaks early, allowing rapid public health responses. Community engagement remains one of the most powerful tools in TB prevention. When communities are empowered with knowledge and resources, they can take ownership of their health. Training local volunteers to conduct awareness sessions, distribute masks, and identify suspected cases can dramatically improve early detection and prevention efforts. Grassroots involvement builds trust and bridges the gap between medical systems and the public. International collaboration is essential, too. TB doesn't respect borders, and effective prevention requires coordinated efforts across countries. Sharing data, research, and resources helps track resistant strains and identify emerging patterns. Global initiatives such as the World Health Organization's End TB strategy emphasize the importance of universal healthcare, equitable access to diagnostics and drugs, and sustained funding for research. Drug-resistant TB presents one of the greatest challenges to prevention. Strains that don't respond to standard medications can linger longer in communities and spread easily. Preventing the emergence of resistance means ensuring proper treatment adherence, avoiding unprescribed antibiotic use, and developing new treatment regimens. Investing in research for shorter, more effective drug courses can improve compliance and stop resistance from spreading. Another overlooked aspect is mental health support for TB patients. Depression, stigma, and isolation can lead to poor treatment adherence. Providing psychological counseling, support groups, and community encouragement helps patients stay motivated through long recovery periods. A healthy mindset contributes directly to better health outcomes and fewer relapses. Health workers also need continuous training to recognize TB symptoms, implement infection control practices, and manage patients with empathy. Equipping them with protective gear, education, and incentives ensures they remain motivated and safe. In resource-limited settings, empowering community health workers with basic diagnostic tools can fill gaps in care delivery. Research and innovation are at the heart of TB prevention. Scientists around the world are working on new vaccines, faster diagnostics, and safer treatment options. Encouraging investment in TB research is crucial to staying ahead of evolving bacterial strains. Governments and private sectors alike must support innovation as part of the broader health strategy. Environmental factors can influence TB transmission as well. Urban air pollution and exposure to dust particles can irritate the lungs, making them more susceptible to infection. Policies that promote clean air, safe housing, and green spaces indirectly reduce TB incidence. Health and environment policies should therefore work hand in hand. Education in schools can also play a preventive role. Teaching children about TB, hygiene, and healthy habits helps build a generation that understands disease prevention from an early age. Including TB awareness in curriculum and community outreach builds long-term resilience in populations. Public transport and prisons are high-risk settings for TB spread due to crowding. Implementing regular screenings, ensuring proper ventilation, and providing access to healthcare for inmates and commuters are vital. Special interventions in such environments can prevent outbreaks that might otherwise spread rapidly into the broader community. Migration and mobility add another layer of complexity. People moving from high TB burden regions to others can unintentionally spread the infection. Cross-border screening programs, migrant health cards, and cooperation between health authorities can manage this risk effectively. Addressing TB among migrants and refugees requires compassion and strong coordination. Many displaced people live in overcrowded camps with limited healthcare access, creating ideal conditions for TB transmission. Governments and NGOs must ensure that TB screening and treatment services are integrated into humanitarian programs so that no one is left untreated due to lack of documentation or fear of deportation. Mobile clinics and outreach teams can help reach these vulnerable populations effectively. Early detection and treatment in these groups not only protect them but also prevent the spread of TB to host communities. Another significant factor in TB prevention is ensuring a reliable supply of medications. Interruptions in drug availability can cause treatment delays, increasing the risk of transmission and resistance. National health authorities and international organizations must coordinate logistics to maintain continuous drug supplies, even in remote regions. Strengthening supply chains, maintaining buffer stocks, and ensuring local manufacturing capacity can prevent critical shortages. TB prevention also benefits from strengthening primary healthcare systems. When local clinics are well-equipped, staffed, and trusted, people seek care earlier, and cases are identified before they become contagious. Integrating TB services into general healthcare rather than treating them as standalone programs encourages routine screening and helps normalize discussions about the disease. Accessible and affordable healthcare reduces barriers that often delay diagnosis. One of the most overlooked yet effective prevention methods is regular screening for high-risk groups. People with diabetes, chronic lung disease, HIV, or those taking immunosuppressive drugs are more susceptible to TB. Conducting routine TB tests for these individuals helps catch infections early and prevents the disease from spreading. Periodic workplace and community health checks can also serve as powerful preventive measures, especially in high-burden areas. Improving diagnostic infrastructure in rural regions is equally important. Many communities lack access to proper laboratory testing, causing underreporting and misdiagnoses. Portable diagnostic tools, mobile X-ray units, and telehealth consultations can extend TB services to remote areas. Governments can deploy rapid testing kits and empower local clinics to diagnose TB quickly without waiting for centralized lab results. Faster diagnosis means faster isolation and treatment, reducing the risk of spreading the bacteria. Housing improvements form another layer of TB prevention. Damp, dark, and crowded living conditions create an ideal environment for TB transmission. Governments and urban planners can mitigate this by promoting housing designs that prioritize light, air circulation, and space. Subsidized housing programs, especially for low-income families, can play a critical role in curbing TB in densely populated regions. Public health must collaborate closely with urban development authorities to ensure healthier living spaces. TB control also relies on effective isolation practices for active cases. Patients with contagious TB should stay in well-ventilated rooms and avoid close contact until they are no longer infectious. Family members should use masks, practice hand hygiene, and avoid sharing personal items. Hospitals and clinics should have isolation wards where airborne infection control standards are strictly maintained. Once the patient's sputum tests show no bacteria, they can safely reintegrate into normal life. Workplace awareness campaigns can make a remarkable difference. Employers can display educational posters, distribute pamphlets, and conduct periodic health talks about TB. Encouraging employees to report symptoms like prolonged cough or chest pain without fear of stigma can lead to earlier detection. Workplaces with health insurance benefits should also include TB screening and treatment coverage, helping employees receive timely care without financial stress. Social support for TB patients should never be underestimated. Poverty, isolation, and fear can discourage people from completing treatment. Community-based support programs offering food packages, transportation assistance, or small stipends can motivate patients to continue their medication. When patients feel supported by society, they're more likely to recover fully and less likely to spread infection. Compassionate community engagement transforms prevention from a medical duty into a shared human responsibility. On the policy level, governments must treat TB as a national priority. Implementing strong surveillance systems, funding research, and ensuring universal access to care are non-negotiable elements of prevention. Transparent data collection helps identify hotspots and guide interventions. Political will and leadership determine how effectively a nation can curb TB. Legislators, health ministers, and policymakers must coordinate efforts to ensure sustained funding for prevention programs rather than short-term campaigns. Media also plays a vital role in prevention. Television, radio, and social media platforms can help educate the public about TB symptoms and prevention steps. Influencers and celebrities can help destigmatize the disease by spreading awareness messages. Campaigns using relatable stories or testimonials encourage people to seek medical help early. Social media challenges, short films, or community events about TB awareness can engage younger audiences effectively. Another area worth focusing on is integrating TB education into community-based schools and vocational programs. Teachers can discuss how TB spreads and why early testing matters. Schools can host awareness events, encourage students to share the knowledge with their families, and collaborate with local health workers for screening drives. When knowledge reaches households through children, the ripple effect is powerful. Spiritual and faith-based organizations can also contribute. Religious centers are trusted spaces where communities gather. Imams, pastors, priests, and monks can use sermons to raise awareness, encourage compassion for TB patients, and dispel harmful myths. Faith-based health camps and counseling services can help reach populations who may hesitate to visit hospitals. Combining faith and health education builds trust and accelerates prevention outcomes. Global initiatives like the WHO's End TB strategy set clear goals for reducing TB cases worldwide by focusing on prevention, treatment, and social protection. Countries must adapt these global goals into national strategies that suit their specific contexts. Collaboration between nations allows sharing of successful interventions, medicines, and research findings. The COVID-19 pandemic showed how international cooperation can accelerate scientific progress, and the same energy is needed to fight TB.